Gastroesophageal reflux disease, also known as GERD, produced by Marina Gates and Rosalinda Rios. Pathophysiology. GERD is a chronic condition in which gastric secretions from the stomach reflux flow backward into the esophagus. If this happens on a regular basis, this will cause esophagitis. What happens is the backup or the reflux of stomach acids and juices in the esophagus that occurs with GERD. It wears away the lining of the esophagus and causes sores that are known as peptic ulcers. The gastric contents are so acidic that the damage to the esophagus occurs, and that's what is known as the sores, which are peptic ulcers. GERD is primarily caused because of conditions that affect the lower esophageal sphincter. These conditions do not allow the sphincter to close tightly and allow the backflow of the gastric contents. There are 4 stages of GERD. Stage 1 is mild GERD, Stage 2 is moderate GERD, Stage 3 being severe GERD, and Stage 4 is reflux-induced precancerous lesions or esophageal cancer. Risk factors for GERD include hiatal hernias, overweight, obesity, pregnancy, cigarette smoking, and a variety of medications such as pain relievers and antidepressants. Signs and symptoms. Reoccurring symptoms that appear more than 2 to 3 times per week and can indicate the presence of GERD include heartburn, which is a painful sensation in the region of the chest behind the sternum, occurring 2 to 3 times weekly and usually is worse at night. Regurgitation, dysphagia, which is trouble swallowing, acid reflux, which most people do not know that acid reflux can also cause voice problems or symptoms in the pharynx, vomiting, and globus, the feeling of food being stuck in one's throat. Available testing/surgery. For the first available test, we have endoscopy, which is a procedure where a flexible endoscope is inserted through your mouth and it is used to look inside your esophagus. For the next testing we have listed is barium swallow study. And the barium swallow study is often done by a radiologist, and the following steps include sitting or lying on an x-ray table. You are then given a flavored drink to make the swallowing easier. While you swallow, the radiologist watches the images of the barium traveling down your throat into the upper GI tract. Next, we have the 24-hour esophageal pH study, which measures the amount of reflux, both acidic and non-acidic, that is in your esophagus during a 24-hour period. Last we have listed is a surgery that is offered. This is called fundoplication surgery. During fundoplication surgery, the upper curve of the stomach, which is known as the fundus, is wrapped around the esophagus and they sew it into place. This is so that the lower portion of the esophagus passes through a small tunnel of stomach muscle. What this surgery does is strengthens the valve between the esophagus and the lower esophageal sphincter. This stops acid from backing up into the esophagus so easily. This will allow your esophagus to heal.
Populations most affected by GERD. The Middle East, North America, Europe, and South America have the highest percentages in populations most affected by GERD. Australia and East Asia have a very low percentage compared to the other 4. But of course, it doesn't matter where you're from or where you live or what your ethnicity is. What causes GERD are the risk factors that we talked about earlier, such as being overweight, being obese, if you're pregnant, or if you smoke cigarettes. These are the risk factors that will cause you to get GERD. The average cost of treatment for GERD. There are many different factors that can determine the overall cost of GERD treatment. Treatment costs vary on things such as generic or name brand medications, whether a person has insurance or not, and the severity of the person's GERD case. In some cases, surgery may be needed. So we can see here that over-the-counter meds are typically anywhere between $4 and $25. generic medications are somewhere between $24 and $271. Brand name medications are more expensive because they are brand name, so they will be somewhere between $142 and $214. And surgeries can cost anywhere from $7,000 to $22,000. Risks of treatment. Prolonged use of GERD medications can heighten risks of dying of heart disease, kidney failure, or stomach cancer. Of course, if you're taking something such as Tums every once in a while, that's not really going to affect you, but if you're taking actual medications prescribed by your doctor for a very prolonged time, then you are at risk for these diseases. For the diet, what we do want to promote are high fiber foods, alkaline foods, and watery foods. So for high fiber foods, we have whole grains such as oatmeal, couscous, and brown rice, root vegetables such as sweet potatoes, carrots, and beets, green vegetables such as asparagus, broccoli, and green beans. For alkaline foods, we have bananas, melons, cauliflower, and nuts. For watery foods, we have celery, cucumber, lettuce, watermelon, broth-based soups, and herbal tea. What you do want to avoid are fried or fast foods, carbonated drinks, cheese, processed snacks, processed meats like bacon and sausage, spicy foods, chocolate, peppermint, and citrus fruits. I have GERD myself, and it is very much in your favor to avoid these types of foods because they will cause you really bad heartburn. Date of discovery / discovered. There was not that much information on the date of discovery or who discovered it, but GERD was first described in 1925. Comments were made by gastroenterologist Friedenwald and Feldman regarding heartburn and its possible relationship to a hiatal hernia. And then we have gastroenterologist Asher Winkelstein, who described reflux and attributed the symptoms to stomach acid in 1934. Preventative strategies. When a person has GERD, you need to avoid smoking, you need to avoid consuming large meals, and you need to keep yourself elevated as much as possible. You need to allow 3 hours after eating a meal before laying down. You need to keep away from certain meds such as aspirin, and for my partner Marina, she said doxycycline made her heartburn very intense, so she had to stop taking that medication. And of course, you need to exercise to maintain a healthy weight, and all of these will help you prevent getting GERD.